He may even identify himself with it and believe that he is what he appears to be.
Welcome to the NCE Study Guide. I created this study guide using ChatGPT and Notebook LM. So think of these modules as AI-powered audio flashcards. Each one of these 20 modules contains 10 mock questions representing the kind of questions that you might encounter on the National Counseling exam. I created this primarily for myself, and I decided to make these available to anyone else who might benefit from this kind of study aid. But please note, while I have done my best to ensure that these modules align with NCE content, I encourage you to cross-reference them with trusted study guides and resources for the most accurate preparation. These modules are not affiliated with or endorsed by the NBCC or any official licensing board. And today I'm introducing a new case study module. Now, as you may already know, I took the NCE and I passed it a few weeks ago, but I learned so much from putting these modules together, and I enjoy seeing the downloads increase and hearing from listeners who reach out. So I've decided to take this case study approach to kind of bridge that gap between prepping for the NCE and really getting started as a mental health care professional in the field, really understanding the ethics and the different modalities and the interventions and how would I do a diagnosis for certain situations. So that's what you're going to be hearing in these case study modules. And I also want to remind you that I'm putting together a grassroots study group for anyone who is looking for some real life person interaction as you prep for the NCE, not just these AI puppet shows. So if you're interested, email me at ncestudyguide@gmail.com. So, with no further ado, here are your AI study buddies from Notebook LM. Enjoy.
Nice to be in orbit.
So you're getting ready for the NCE, huh? Well, you've sent us some super helpful resources, and we're excited to really dive into this with you. Today, we're going to focus on getting you prepped and feeling confident for the National Counselor Examination.
Less overwhelmed and more prepared.
Exactly. More prepared, less overwhelmed.
It's a big one, right?
It is.
So let's jump into Case Study Module 1.
Module 1 of 10. Our main source for today is the NCE Study Guide,
Right.
created by Glenn Ostlund.
Pretty interesting background on him.
Yeah, he's got master's degrees in both folklore and clinical mental health counseling.
So already, he gets people and their stories.
And the fact that he's been podcasting since 2010,
Oh, wow, yeah.
that means he really knows how to communicate.
Get early, yeah.
But what's really cool is that he recently passed the NCE himself,
That's huge.
which means he gets it.
Yeah.
He understands what it's like to go through this process,
Firsthand.
and he created this study guide as part of his own prep. He wanted something that was really grounded in research, but also super practical.
So he was feeling that same need.
Something that you could apply to real situations.
Absolutely.
And I think that's what a lot of people are looking for, right? Information that's thorough,
Right.
but not overwhelming.
Useful.
Useful. Now, the way he put this study guide together is fascinating. He calls it his AI puppet show method.
AI puppet show. Okay. I'm intrigued.
I know, right?
Yeah.
It sounds a little strange, but it's really interesting.
Yeah.
Essentially, he used ChatGPT as a starting point to draft these case studies and refine them,
Interesting.
really digging into the theories and research,
Yeah.
ethical considerations, all of that. It's like having a super-powered research assistant.
I was going to say, like, nonstop,
Like-
working 24/7 to make this thing.
Exactly. And then all of that goes into a Google Doc,
Yeah.
and he uploads that to Notebook LM,
Notebook LM.
which is an AI tool that can organize and summarize huge amounts of text.
That sounds very helpful for this kind of project.
It is. It is. And then Notebook LM takes over.
And does the magic.
Yeah.
So what does it actually do?
It takes all that information, and based on, instructions that Glenn gives it,
Okay.
it explores it from different angles.
That's cool.
So it's not just spitting back information, it's actually engaging with it.
Like a study partner almost.
Like a study partner. That's a really good way to put it.
Right.
And so the result is, and you'll see this as we go through the case, a really dialogue-rich,
Okay.
insight-driven learning experience.
I like it.
And it's meant to mimic how you actually have to think when you're taking the NCE.
So it's application, not just memorization.
Right, right. Not just memorizing definitions,
You got it.
but really understanding how to apply the concepts.
Because that's what the NC is going to ask you to do.
Exactly.
You're going to have to apply it,
Yeah.
not just know what the definition of transference is.
It's those aha moments.
You got it.
Now, if you find this deep dive helpful and you want to connect with other folks who are also prepping for the NCE,
Right.
Glenn has a weekly study group that's open to anyone listening to this material.
Very cool.
And it's a chance to discuss these concepts, ask questions, support each other.
Yeah.
So if you're interested, just shoot an email to anceststudyguide@gmail.com.
Perfect.
And since these deep dives are really for you, we want to make sure we're covering what you need.
Of course.
So if there are any specific case study topics or counseling issues you want us to explore in future modules,
Yeah. Let us know.
definitely tell us, because your input really shapes what we cover.
It drives the content. So
Yeah.
if there's something you're struggling with or you're like, man, I wish they would talk about this,
Yes.
send us an email.
Send it to us.
Yeah.
Okay, let's jump into our first case.
All right.
It's titled, James, the Overwhelmed Teacher.
Okay.
We're going to walk through his presenting problem, talk about those ethical considerations,
Right.
look at assessment, potential diagnoses,
Uh-huh.
different theoretical approaches a counselor might take,
Yeah.
and some initial interventions. So let's get to know Juds a little bit.
Let's do it.
James is a 32-year-old high school English teacher,
Okay. High school English teacher, 32.
and he's self-referred for counseling.
Self-referred.
For the past 4 months, he's been dealing with, well, persistent anxiety.
Always there, huh?
He's having trouble sleeping,
Okay.
and he's noticeably more irritable than usual.
Yeah, I can imagine that would come along with those other things.
He also reports this recurring feeling of impending doom,
Impending doom. Wow.
especially on Sunday nights.
Sunday scaries taken to a whole new level.
Right. And he's got racing thoughts that are focused on work.
Okay, so that Sunday night feeling is directly tied into work.
Exactly.
Got it.
And he's pulling back socially.
Oh,
He's feeling constantly fatigued, and he's losing interest in hobbies he used to enjoy.
so there's a lot of change happening.
Big changes. Now, he denies any active suicidal thoughts
Okay.
or plans, but he does say things like, I don't want to deal with this anymore.
So even though he's not explicitly suicidal,
Right.
that's a pretty strong statement.
It is a strong statement,
Yeah.
and it definitely signals a deep level of distress.
It does.
Looking at his history, there's no record of prior counseling or psychiatric treatment,
Okay.
and he reports no major medical concerns,
Okay.
but he does have a history of being a high achiever
Okay.
with those perfectionist tendencies.
Oh, there it is.
I was just thinking about that when you mentioned, him being a high school English teacher.
Uh-huh.
It's a pretty demanding job.
Yeah, absolutely.
And then there's a family history of both anxiety and depression.
Okay, so the biological piece as well as the environmental piece is coming into play here.
Right, so we've got that family history, and it's something to definitely keep in mind because it can often play a role.
Yeah.
Okay, now let's shift gears a bit to those ethical considerations.
Right, because we're thinking about this from a counselor's perspective.
Exactly. The NCE study guide highlights several key areas here, and a counselor would need to be thinking about these right away,
From the first session.
from the get-go. The first one, of course, is informed consent.
Yeah, that's essential.
Before any real work begins, the counselor needs to have a very clear and thorough discussion with James about what therapy is all about.
Therapy 101.
Explaining things like confidentiality,
Right, the limits of that.
what information is kept private, when that confidentiality might need to be broken.
Yeah, those are important.
It's also about explaining what James can expect from the therapy process itself.
Yeah.
What the counselor's approach
Yeah,
is,
what's their theoretical orientation?
what his role is in the therapy.
And how long it might take or what the goals might be.
Right. Setting those expectations up front
Yeah,
can prevent a lot of misunderstandings.
for sure.
The guide also mentions scope of practice.
Okay, and what are the key considerations here for James's situation?
Well, scope of practice means working within the boundaries of your training and your expertise.
Right.
So for James, this would mean using standardized assessment tools
Mm-hmm.
to really get a grasp of his symptoms and how severe they are.
Okay, and what tools come to mind?
We'll get to those in a bit.
Okay.
But it also means recognizing when his needs might be beyond what the counselor can handle
Okay.
and knowing when to refer him to a specialist.
Makes sense. And when might a referral be necessary in a case like this?
Well, if his symptoms were super severe
Okay.
and medication seemed like it could help,
Okay.
then a referral to a psychiatrist would be essential.
Right. Absolutely.
Another important ethical consideration is cultural sensitivity.
Cultural sensitivity. So how does that come into play with James?
Well, there are a couple things to think about. We need to acknowledge how stressful his job is.
Being a teacher.
Teaching.
Yeah.
It's a demanding job,
High stress.
high stress. It could be very emotionally draining. And the culture of his specific school environment could be playing a part in his anxiety.
Oh, interesting.
Also, his perfectionist tendencies.
Right.
While that's not a traditional cultural identity,
It is a driving force, right?
it's a powerful internal driver
Yeah.
and shapes his expectations for himself.
Yeah.
So the counselor needs to approach these aspects with sensitivity.
And not pathologize them.
Right, exactly. The final ethical point the guide mentions is dual relationships.
Dual relationships. Always tricky.
Why would that be a concern with James?
Well, because he's a teacher in, presumably a community where the counselor might also have connections.
Right.
Maybe their kids go to the same school.
Or they're involved in other community organizations together.
Exactly. That overlap
Right.
could be tricky.
It can lead to conflicts of interest, blur those professional boundaries.
Absolutely.
So the counselor needs to be aware of these possibilities from the beginning.
And screen for them.
Screen for them, and if they do exist, talk about them openly with James.
Yeah. Transparency.
Make sure his well-being is the top priority.
You got it.
Okay, let's move into assessment and diagnosis.
All right. So what's the initial thinking here?
Well, based on what James is presenting,
Yeah.
with the persistent anxiety, the trouble sleeping, the irritability, those racing thoughts he's been having for 4 months,
Yeah.
the most likely diagnosis to consider is generalized anxiety disorder, or GAD.
GAD.
Makes sense.
And there are a couple of other diagnoses that a counselor would want to rule out.
Okay, what are those?
One is major depressive disorder, or MDD.
NBD.
Now, James doesn't have that classic sadness or loss of interest that defines MDD.
Right.
But some of his symptoms, like the fatigue, the social withdrawal.
And that feeling of just not wanting to deal with things anymore.
Right, those could overlap.
You really need to do a good assessment.
A good assessment. And the other one to rule out is adjustment disorder with anxiety.
Adjustment disorder. Okay, and what would make that a consideration? Well, if his anxiety seemed to be a direct response to a specific stressor,
Okay.
something that happened in the past 3 months.
So something really recent and clear?
Exactly.
Okay.
And those symptoms would be expected to lessen once that stressor is gone.
Yeah, if it's just a temporary thing.
Right. Or if he's able to adapt to it.
Makes sense.
Now, to clarify the diagnosis and figure out how severe James's symptoms are, a counselor would use some assessment tools.
Oh, yeah. What tools might they use?
The guide mentions the GAD-7.
GAD-7.
It's a short questionnaire,
Okay.
just 7 items.
So quick and easy.
Self-report, and it's specifically for measuring those generalized anxiety symptoms.
Oh, perfect.
And the other one is the PHQ-9,
PHQ-9.
which is similar to the GAD-7, but it measures depressive symptoms.
Okay.
Even if GAD seems like the most likely diagnosis, it's always good to check for depression.
Because they often go hand in hand.
They do. And beyond these questionnaires, the clinical interview itself is so important.
Of course.
This is where the counselor can really dig into specifics.
Yeah, get a deeper understanding.
When did these symptoms start? What makes them worse?
Right.
How are they impacting his daily life, his work, his relationships?
Right. That functional impairment piece is key.
Absolutely. Okay, let's talk about those different theoretical approaches a counselor might consider with James.
Okay. So we're going to put on different lenses
Exactly.
and see how those might apply to his case.
The guide talks about cognitive behavioral therapy, or CBT,
CBT. Very
person-centered therapy,
Uh-huh.
and solution-focused brief therapy.
Okay, let's start with CBT. How might that help James?
Well, CBT is really action-oriented.
Yeah, it is.
It focuses on those negative thoughts and behaviors that might be fueling his anxiety.
So it's about recognizing those patterns.
Yeah, identifying them and then changing them.
Cool.
So with James, it would be about helping him identify those specific thoughts he's having.
Like those racing work thoughts.
Yeah, like those work thoughts. And then looking at whether those thoughts are accurate.
Okay. Checking the facts.
Is that helpful?
Right.
CBT also looks at how our thoughts, feelings, and behaviors are connected.
Oh, yeah, that triangle.
So it might involve changing some of his behaviors,
Okay.
like the social withdrawal, through things like behavioral activation.
So getting him back out there doing the things he used to enjoy.
Exactly.
Yeah.
It's
Yeah.
all about giving him practical tools
Yeah, skills.
to manage his anxiety in his daily life.
I like it.
Now, person-centered therapy is totally different.
Yeah, it's a different vibe.
It's all about the therapeutic relationship.
That's the heart of it.
So how do you think that would apply to James?
Well, it's all about creating that safe, accepting space,
Right.
non-judgmental. He can just be himself.
Yeah. And for someone like James, who's never been to therapy before
Who's feeling overwhelmed.
and is feeling overwhelmed, this approach can be huge for building that trust.
Right, that foundation.
So he can explore his feelings, without feeling judged.
So the therapist would embody empathy.
Empathy, genuineness, and unconditional positive regard.
Those core conditions, right?
Well, core conditions.
Yeah, so it's less about techniques and more about that connection.
Right, the relationship itself is seen as the catalyst for growth.
Beautiful.
And then we have solution-focused brief therapy.
Solution focus. What's the focus there?
It's all about, well, solutions
Okay.
and the future.
Where we're thinking. Yeah.
Instead of digging into the past,
Right.
the therapist would work with James to identify his strengths, what he's already good at,
Is resources.
and help him picture what his life would look like.
If the anxiety wasn't such a problem.
Right. It's very goal-oriented,
Okay.
setting achievable goals and figuring out steps to get there.
I like that. Concrete steps.
So, with those theoretical approaches in mind, what specific interventions might a counselor use?
Okay, let's get practical.
The guide breaks it down into early and middle phases of therapy. What might happen in those first few sessions?
Well, in the beginning, it's all about psychoeducation.
Psychoeducation. Explain what that is.
So it's about teaching James about anxiety.
Right.
What's happening in his body, his mind, when he's feeling anxious.
So he understands it better.
Exactly. It can be very empowering.
Right.
It can help him feel less like he's going crazy.
Yeah. At the same time, that therapeutic relationship is so crucial.
Of course, that foundation.
James needs to feel heard,
Right.
understood, and safe with his counselor.
Absolutely essential for any progress to happen.
As therapy moves into that middle phase,
Okay, middle phase.
what are some specific interventions they might try?
Well, if they're using CET, they might use thought records.
Thought records?
These are tools that help James identify those automatic negative thoughts.
Oh yeah, those things we don't even realize we're thinking sometimes.
Exactly.
And then examine the evidence for and against them.
Okay.
Come up with more balanced thoughts.
So he's not just stuck in that negative loop.
Right. They might also use relaxation training.
Like deep breathing.
Deep breathing, progressive muscle relaxation
Those are classics.
to help him manage those physical symptoms.
Yeah, that
And
tension.
especially those Sunday night fears.
Right, when that anticipatory anxiety peaks.
If they're drawing from SFBT,
Okay, solution focused.
they might use scaling questions,
Scaling questions. What are those?
asking him to rate his anxiety, like on a scale of 1 to 10,
Okay.
and then figure out what he can do to move up 1 point on that scale.
I like that. Small steps.
Small steps. They might also focus on solution talk,
Solution talk.
talking about times when his anxiety was less intense
Okay.
or when he managed stressful situations well.
So highlighting those successes.
Exactly.
What are some signs that James is actually benefiting from the therapy?
The guide mentions some key indicators of progress.
Okay, tell me.
One would be a decrease in his scores on those assessments, like the GAD-7.
Yeah, so those numbers would be going down.
Right.
Objective measurement.
Right. We'd also hope to see James understanding his anxiety better.
Okay, so he's getting insight.
He's getting that insight, and he's getting better at managing his feelings.
Regulating his emotions.
Emotional regulation.
Yeah, so he's not so overwhelmed by them.
Right. And finally, we'd want to see changes in his behavior,
Okay, so he's actually doing things differently.
like engaging more socially, going back to those hobbies he enjoyed.
Yeah, getting back out there.
Those are all signs that the anxiety isn't controlling his life as much.
Okay, so those are things we'd be looking for.
Now, as we prep for the NCE,
Right, the big test.
the guide points out some really important takeaways from this case.
So what are those key points for the exam?
Well, it stresses those ethical principles.
Mm-hmm.
Informed consent, maintaining those boundaries.
Yeah, gotta have those strong boundaries.
It also highlights how important it is to do a thorough assessment,
Okay, we're not just guessing.
not guessing,
We're using tools.
using tools like the GAD-7, the PHQ-9, to guide the diagnosis and the treatment plan.
So we have a roadmap.
It mentions CBT and SFBT as two therapies that are really relevant for the NCE.
Yeah, they come up a lot.
And it reminds us that a diagnosis isn't just about the symptoms,
It's about how long they've been going on
how long they've been going on.
and how much they're impacting the person's life.
Right. And finally, it talks about those initial interventions for GE and how to track progress.
Yeah, so we know what to do and how to know if it's working.
Okay, to really solidify everything
Right. Yeah.
and get a feel for the NCE,
Yeah.
the guide has some NCE-style review questions,
Great.
10 multiple-choice questions.
I love multiple choice.
They'll help us test what we've learned.
All right, let's do it.
Ready? Question 1.
Hit me.
Which diagnosis is most likely appropriate for James based on the presented symptoms and history?
Okay.
A. Panic disorder. B. Major depressive disorder. C. Generalized anxiety disorder. D. Adjustment disorder with depressed mood.
So based on what we know about James, his anxiety, his trouble sleeping, his irritability, that Sunday night dread,
Yeah.
which one fits best?
The answer is C.
C, generalized anxiety disorder.
Generalized anxiety disorder. Now, the guide explains that James has that persistent worry. He's restless, irritable, he has that physical tension.
Right.
And remember, for a GAD diagnosis, these symptoms need to be present for at least 6 months.
Oh, right. So even though he's only been experiencing this for 4 months,
Right.
it doesn't quite meet the criteria yet.
But it's the most likely diagnosis given everything else.
Got it.
And that's a really important thing to remember for the NCE.
Yeah.
Those time frames in the diagnostic criteria can be tricky.
They can trip you up.
Okay, question 2. What is the most appropriate initial step when beginning counseling with James?
Yours things first.
A, administering a projective test. B, discussing possible medication options. C, providing informed consent and establishing rapport. D, diagnosing based on clinical impressions.
So when you first meet James, what's the priority?
The answer is C.
C, providing informed consent and establishing rapport.
Informed consent and rapport.
Of course, build that foundation.
That epical foundation. The guide explained that you need that trust and understanding before you jump into anything else.
Yeah, you can't just launch into tests or medication talk right away.
Exactly.
You gotta have that connection first.
Question 3. Which of the following tools would best assess James's anxiety symptoms?
Okay, assessment time.
A, MMPI-2, B, GAD-7, C, Beck Hopelessness Scale, D, TAT, or a thematic apperception test.
So we're looking for the tool that specifically targets anxiety. Which one is it?
The answer is B,
BDGHFN.
GAD-7. And the guide points out that it's designed for exactly this purpose,
Okay.
to measure those generalized anxiety symptoms.
So it's a good choice for James.
Question 4. Which theoretical orientation is most appropriate for addressing James's negative thought patterns and cognitive distortions?
Okay, back to theory.
A, solution-focused therapy, B, Gestalt therapy, C, cognitive behavioral therapy, D, narrative therapy.
So we want to target those negative thoughts.
Which therapy does that best?
Hmm.
The answer is C,
C, cognitive behavioral therapy.
CBT.
It's all about those thoughts and beliefs.
It's specifically designed to address those negative thought patterns.
Yeah, that's CBT's bread and butter.
Question 5. In terms of James's perfectionism and occupational anxiety, what would a solution-focused therapist most likely focus on in early sessions?
Okay, so we're putting on that solution-focused lens.
Right.
What's the focus?
A, exploring past trauma. B, interpreting dream content. C, identifying exceptions to the problem. D, providing a diagnostic label.
What would a solution-focused therapist prioritize?
The answer is C,
C, identifying exceptions to the problem?
identifying exceptions to the problem.
Of course, because SFBT is all about solutions and moving forward.
Right. They'd be looking for times when those issues weren't as bad,
Okay.
even if it was just for a little while.
And then building on those successes.
Exactly. Question 6. Which symptom listed below would indicate a need for immediate referral to a psychiatrist or other provider?
Okay, this is important.
A, fatigue. B, perfectionistic thoughts. C, passive suicidal ideation. D, occasional procrastination.
When do we need to get someone else involved?
The answer is C,
C,
Yeah.
passive suicidal ideation.
passive suicidal ideation,
Yeah, that's a red flag.
even though he's not actively planning anything.
Any mention of not wanting to live?
It needs to be taken seriously.
Absolutely.
Question 7. Which of the following ethical principles is most relevant when ensuring James understands the counseling process?
Ethics again, very important.
A, fidelity. B, veracity. C, autonomy. D, non-maleficence.
So we're talking about making sure James knows what he's getting into.
Which principle applies here?
Mm.
The answer is C,
C, autonomy.
autonomy, making sure he can make informed decisions about his treatment.
His right to choose.
Right.
Okay, question 8. What CBT intervention would best help James manage anticipatory anxiety on Sunday nights?
Back to those Sunday night fears.
What can we do?
A, dream journaling. B, challenging automatic thoughts with evidence. C, free association. D, genogram work.
Which one fits with CBT?
The answer is B,
B, challenging automatic thoughts with evidence.
challenging those automatic thoughts.
So looking at those thoughts and seeing if they hold up.
Exactly.
Okay.
Question 9. A counselor working with James in a small town realizes they attended the same church. What should the counselor do?
Oh, this is a tricky one.
Dual relationships.
Yeah.
A, refer immediately. B, discuss dual relationship boundaries with James. C, keep it private and continue treatment. D, avoid attending church during the time James is a client.
What's the best course of action?
The answer is B.
B, discuss dual relationship boundaries with James.
Discuss those boundaries.
Yeah, transparency is key.
The counselor needs to be open and honest with James.
And make sure his needs come first.
Right.
Okay.
And question 10, which progress marker would most likely suggest that counseling is effective for James?
So we're looking for signs of improvement.
A, client continues to feel tired. B, GAD-7 scores remain high. C, increased use of self-help strategies and improved sleep. D, more avoidance of social events.
Which one shows he's getting better?
The answer is C.
C, increased use of self-help strategies and improved sleep.
That's what we want to see.
He's using those tools and he's sleeping better.
Those are concrete signs of progress.
Awesome.
So that's it for our review of Case Study Module 1.
That was helpful.
We hope this has been helpful for your NCE prep.
Remember, it's not just about knowing the right answer
It's about understanding why.
and applying that knowledge.
Just a reminder, this was Case Study Module 1 of 10 from the NCE Study Guide.
There's more to come.
If you're interested in joining Glenn's weekly study group to really dive deeper into these topics with other folks prepping for the NCE,
Yeah, join the group.
you can reach out to ncstudyguide@gmail.com for more info.
Awesome.
And keep sending us your suggestions for future topics.
Yeah, we want to know what you're struggling with.
We do. Your feedback helps us make these deep dives as relevant as possible.
Absolutely.
Think about how working through case studies like this helps you connect that theoretical knowledge with real-world situations.
Yeah, it brings it all together.
What other strategies can you use in your study routine to really make that connection?
That's a great question.
1, 2, 3.
Nice to be in orbit.